Welcome to Chai with Cheruba this Thursday. We're going to be doing something a little different. We're going to be doing hot flash rounds, which are just a rapid fire of questions that you guys may have. I get a lot of questions on the YouTube comments and DMs, and I don't always get to, answer all of them. So I figured we'll kind of put them together and answer some during this time. And you guys are also welcome to ask questions live. Um, so we're excited to be here, and wherever you are, grab your cup of chai and join me. I actually have my water today. My goal is to drink like 3 of those bottles every day. So I am, um, focusing on that this morning. So let's start with questions. What questions do you guys have? Yesterday I did an amazing talk on perimenopause and menopause in San Francisco. It was so great. People asked such good questions, and it was so exciting to see women in their late 20s and 30s even come, even though, they're not at that stage of life, but just to learn more and get educated and be able to advocate for themselves as time went on. So it was awesome to see that. And so happy to answer any questions about perimenopause, menopause, or fibroids, whatever you guys have. So Blessy, do we have any questions that we can put up? Okay. From folks. So, hello, can calcified fibroids be removed via myomectomy? Calcified fibroids are tough because they are essentially a ball of old fibroid that's been there for a long time, and it becomes super hard. So it's almost like a baseball. That's what I think of when I think about a calcified fibroid. So using our usual techniques, it's really hard to get out of the body. So doing a myomectomy is not a problem. You can remove the fibroid from the uterus, but then getting it out of the body via a robotic approach is difficult. I remember a case that I did a few years ago when I made this tiny incision in the belly button, wanting to get this patient's fibroid out. Got the fibroid out of the uterus, but then it was so calcified that I was not able to cut it out. And then I had to call for a bone drill from the orthopedic surgeon's set, and I had to drill the fibroid using a bone drill. Okay, a bone drill is used to drill bone, so I had to use that drill to actually chip off pieces of this fibroid to get out of my incision. Now, my incision was only 2 centimeters in the belly button because I was doing this robotically. But of course, if you enlarge the incision a little bit, or you were doing a myomectomy via an open approach, like a C-section incision, it should not be a problem to get out a large fibroid that way. So it really depends on exactly how you're doing it. And again, taking it out of the uterus is not a problem, but taking it out of the body through tiny incisions is a problem because they're very hard to cut. So hopefully that helps. Okay. Okay, so this was helpful, made me feel confident in my choice to use HRT. This is probably referring to one of my videos. I feel better than I have in probably a decade since I started using my bioidentical estradiol patch and oral progesterone. Great. So I love this comment, and I want to just touch a little bit on what bioidentical hormones are, because this is often a buzzword that people are throwing out there, and it's very confusing. It's confusing to patients, it's confusing to doctors. Many doctors are also confused by this if you don't do this all the time. So bioidentical just means that the the chemical structure of the hormone that you're using is the same as that produced by your body. So when we think about hormone therapy, estradiol is your bioidentical estrogen, and prometrium or progesterone is your bioidentical progesterone. So there's only one bioidentical, progesterone out there, which is goes by the trade name of Prometrium. Generic is just progesterone. So this is what we use for hormone therapy. And these are FDA approved products. These can be, ordered by your doctor. You can get them at the local pharmacy. You don't need fancy creams or, expensive things for hormone therapy. So make sure you see a menopause certified doctor. You can go to the menopausesociety.org, put in your zip code, find out where, find a doctor near you who has done this extra menopause certification and taken the exam, and go see them, and they can talk to you all about bioidentical hormones. But I'm so glad you feel better. And this is absolutely, I love hearing this. And if you are somebody in menopause or perimenopause and suffering, don't suffer. There is amazing care out there and you deserve it. Go find it. Okay. Do fibroids make your period smell? That is a really good question. I think most women have some sort of an odor when they get their period anyway, because it is, blood smells. And fibroids, for some women, especially around their period, the blood vessels around fibroids are disrupted, around the uterus are disrupted, and you can often bleed more. So I don't know that it's fibroids that make your period smell, but I think it's more the fact that you can have fresh blood, more blood, a pooling of old blood, and that smells, if that makes sense. But that's a very good question. Okay. Exercise increases blood supply to the pelvic region. Does that mean exercise will also increase the fibroid's size? Um, Good question. So, no, exercise does not increase fibroid size. Um, and blood supply does not increase fibroid size. When we think about blood supply to the pelvic region, we're just talking about, blood supply to the vessels that run through our pelvic region, not necessarily those that are feeding particular fibroids. So no, you do not have to worry about exercise increasing fibroid size. What does increase fibroid size is estrogen. So a lot of times in pregnancy, we'll see fibroids grow. With certain medications, we may see fibroids grow. So there's other factors, but not exercise. Exercise is great. It's anti-inflammatory, and I highly recommend it to actually help with fibroid symptoms and growth. Um, when fibroids are dead, how does it pass out the womb, and how will the woman know? Okay, so when we say fibroids are dead, we actually, the word that you may see described is degeneration. And this means that the fibroid is is losing blood supply, because it's dying or degenerating. And this can be extremely painful. So if you are having, you have fibroids and you have extreme cramping, like more than usual, terrible cramping, think about degeneration or the fact that your fibroid could be dying away. This is extremely painful. This tissue will pass out of the vagina. Sometimes it's dark. Sometimes it's black, actually, and it has a smell. It has a foul smell. It has a lot of you can have a lot of discharge, and so this is something to think about if you're experiencing those symptoms along with pain. So it'll be obvious that you're passing it out. Typically, large fibroids just don't die and completely pass out, but there are pieces that can come out. We do a procedure called the uterine artery embolization, which takes little pellets and shoots them into the arteries that supply the fibroids and the uterus, and that intentionally causes fibroid to degenerate and die. And so in those cases, you can expect this to be happening over the next several weeks. But it's rare that fibroids just spontaneously die and pass out. But it will be obvious when that happens. If patient having hysterectomy, that means there's no menses anymore. Correct. When you have a hysterectomy, no more periods. So patients have hysterectomies mainly for heavy bleeding, fibroids, other GYN conditions. But if you take out the uterus, there's no more lining to shed, and you will not get a period anymore. So correct. Can we get pregnant after losing your ovary due to a dermoid cyst? Yes, you can absolutely get pregnant after losing an ovary. You just need one ovary to produce all the estrogen you need, to produce follicles and eggs that you need. And so, yes, you just need one ovary and you can still get pregnant. You will not be put into early menopause. And yes, life can go on. Is uterine artery embolization effective for adenomyosis? Hi. So, it is something we try for adenomyosis. In patients for whom surgery is going to be difficult or they don't quite want to attempt it yet, yes, embolization can definitely be tried for adenomyosis because again, the principle is the same in that they are shooting these little pellets into your uterine arteries that can, compromise blood flow and can help dramatically decrease the bleeding and also the size of the uterus. Now, it I do not always recommend it for those who are trying to get pregnant in the future because, again, we've compromised some of the blood supply of the uterus. And so, if you are trying to get pregnant in the future, we don't want portions of the uterus to be, devoid of healthy blood. Or so it is not something I recommend for those who are actively trying to get pregnant. Now, have people gotten pregnant after this procedure? Yes. In fact, in my own practice, I had somebody have an embolization and then go on to have a great pregnancy. So it can definitely happen, but if it can be helped, we would rather do it after pregnancy. All right. Can one conceive with calcified fibroids? Yes, you can definitely conceive with calcified fibroids, but it all depends on where it is. So, like any fibroid, if it is in the uterine cavity, or if it's so big that it's, just taking up the entire uterus, well, that's going to be a problem, whether it's calcified or not, whether it's a regular fibroid or not, that could be an issue. So, the fact that it's calcified doesn't make it any harder, but it all depends on the size and the location. Um, any other questions? I have a myomectomy in 2021. I'm bleeding because of fibroids, even after 1 year of Mirena. Looks like that question was cut off. But essentially, yes, the Mirena IUD, the progesterone IUD can really help decrease bleeding. Um, but if your bleeding is, not stopping even after the IUD, you may want to consider the diagnosis of adenomyosis. It is not talked about as much, but fibroids and adenomyosis coexist a lot. So in the same patient, you often have both. So an MRI is really going to be helpful in telling us whether you have adenomyosis. So I would definitely recommend an MRI to try and glean that diagnosis. And an IUD always does not work for adenomyosis. So depending on your fertility status and kind of where you are with that, you may want to discuss further options, including hysterectomy for adenomyosis, if that's what you actually have. Why can women who have had C-sections deliver naturally, but women who have fibroid surgery not? Okay, a good question. So women who have had a C-section, it can attempt to have a VBAC, right, which is a vaginal birth after a C-section. And we do recommend a 2-year gap between pregnancies if you're going to attempt another pregnancy, whether you have another C-section or a vaginal delivery. We recommend some time because it takes time for that uterus to heal and for the scar to kind of completely heal and withstand another pregnancy. And there is a risk of uterine rupture, in subsequent pregnancies, especially if you have a vaginal delivery. And the risk of this is about 1%. So after one C-section, some people do opt to have a vaginal delivery, and provided all the other factors line up, this is okay, and we do allow that in labor and delivery. Now, with fibroid surgery, often fibroids are many and larger than an incision we actually make for a C-section, and they're much deeper. We actually go all through the muscle to go grab this fibroid. With the C-section, we're kind of at the lower uterine segment. It's the muscle is really thin already there. We make a very tiny cut in order to deliver the baby in terms of like the depth that we go. But with fibroid surgery, they're often on top of the uterus, which is the thickest portion of the uterus. Sometimes they're in the back. Again, the muscle is really thick, and we're having to cut a lot to go deep and grab that fibroid that is sitting deep in there. Sometimes we're doing this multiple times, one on this side, one on the top, one on the left, one in the back. Like, we're taking 5, 6 fibroids out. So you can imagine that there are many, many cuts and many sutures around there. So this definitely decreases the integrity of the uterine muscle. So I always tell patients there is a higher risk of uterine rupture. It's about 1.7%. And in this case, we recommend that you do not labor. So we don't even want to get to the process where the uterus is contracting, 10,000 times in order to deliver a baby. So we recommend a C-section ahead of time, around 36, 37 weeks before the uterus gets too big, before you go into labor, so that we can safely just get the baby out and let the uterus go back. So yeah, this is one of the harder things for many women who are undergoing fibroid surgery. They know they need the fibroid surgery, but now they're committed to a C-section, and it's definitely disappointing for many. But not all fibroids will need a C-section. If the fibroid is kind of on the outside, what we call a subserosal fibroid, and we don't really need to dig into the wall of the uterus, then you can go on to have a vaginal delivery. So you should always ask your surgeon who does your surgery, what was it like? Can I have a C-section? Can I have a vaginal delivery? Do I need a C-section? They are the right people to ask. So if you have surgery, make sure you ask that question at your post-op visit. Thank you for the educational video. Can you speak on hemorrhagic multiple ovarian cysts, endoscopic? Okay. Hemorrhagic ovarian cysts are cysts that are filled with blood. We see it all the time. They don't necessarily need to be taken out if you're confident that's benign, right? So if it looks like a hemorrhagic cyst, it's pretty much the same size over a few months, it doesn't give you symptoms, it's not causing you pain, then you can kind of leave it, and every few months, every 6 months or so, get another ultrasound to make sure it's not growing. Some of these cysts go away on their own, but some actually grow. So if they grow and they start to have symptoms and they start to twist and all of that, which usually happens after 5 centimeters, at that point, you're going to want to do surgery. So it's an individual decision, but I would speak to your doctor, maybe get a second opinion before you make a final choice. How long do I need to wear a compression belt? What to eat to shrink or get rid of small fibroids? Okay, so a compression belt is really for your own personal, convenience. You don't have to wear one. I usually recommend it after surgery for the belly, just to kind of keep everything tight and in a position where you can get up and move comfortably. There's a lot of debate on what to eat and drink in order to get rid of small fibroids. And there's a lot of people claiming that there are supplements and tonics and, special capsules that you can use. I would really go back to the basics, and I would do a very anti-inflammatory diet. So I would focus on plants. 80% plant-based is what I recommend with fish. Vitamin D supplementation has shown to help, as well as green tea extract. So maybe drinking a green tea every morning, making sure your vitamin D levels are normal, and then also making sure that you are really eating well, maintaining a good immune system, which includes sleep and exercise, is what I recommend to, shrink small fibroids or any fibroids and prevent them from growing, or even after surgery, preventing the growth of new fibroids. So that's what I would say about that. Okay. What size of fibroid requires a C-section? So it's not, actually, I'm not sure what the question is. I'm not sure if it is if you currently have a fibroid and you're pregnant, or if you've had a fibroid and you've had surgery. So let me talk about a current fibroid. So if you have a current fibroid and you're pregnant and you're wondering, can I have a normal delivery or do I need a C-section? It really depends on where the fibroid is. If it's near your cervix or it's in the lower uterine segment, likely this is not going to work out for a vaginal delivery just because the birth canal will be narrowed and obstructed. If it's, somewhere on the top, it shouldn't really affect it that much. If you have multiple fibroids, the uterine muscle may not contract effectively in order to push the baby out. So there's that. And you may end up trying to have a natural delivery. And then after many, many hours, nothing's really happening. Now, if you've had a fibroid surgery and you're thinking, well, at what size do I need a future C-section? This really is not about size. It's all about location. One time I did a surgery on somebody who had a 25 centimeter fibroid, huge. Okay, I had to do a C-section incision, get it out that way. But she could go on to have a vaginal delivery because, again, it's not about the size, it's about where it was. It was kind of on the outside of the uterus. And so we were able to take out the fibroid, and I told her she could have a vaginal delivery. She went on to have 2 perfectly normal vaginal deliveries. So it's not so much about the size, but the location. We have a couple more minutes left to take some more questions. I tried estrogen cream, and after one application, I got a yeast infection. Oh my goodness, you're not the only one. So estrogen cream overall is very well tolerated vaginally for dryness or painful sex or urinary symptoms. But yes, some people do get a yeast infection. It could be that you're allergic to the base that the cream is suspended in. In this case, you may want to try another formulation of vaginal estrogen, like the pill or the ring, or you may want to, in this point, go to a compounding pharmacy and get the same estrogen cream compounded in a different base that doesn't give you a yeast infection. Good question. I do see this in my practice occasionally, not very frequently, but yes, I have seen patients who automatically get a yeast infection the moment they use the cream. Can I still get pregnant after I had an ectopic pregnancy? I'm 30. Yes, you can still get pregnant. The risk of having another ectopic pregnancy is a little bit higher this time, but yes, you can get pregnant. I would just monitor your levels really closely in the beginning, get an ultrasound early on to make sure it's not another ectopic. But yes, we see it all the time. You can have a successful pregnancy. Are there different options for patients who have had laparoscopic surgery recommended? I'm not sure what this question means. So in terms of, so somebody says, okay, you can have laparoscopic surgery for, I'm assuming for fibroids. You can either have it straight laparoscopy, you can have it robotic, you could have it open. So these are the different options for surgery. But I'm not really sure what this question means in terms of other options. Maybe we can take one more. Okay. So how did you find the cyst prior to surgery? X-ray, MRI, ultrasound? Oh yeah, if you have chronic low back pain, you must start with an ultrasound. I would start with an ultrasound of the uterus and the ovaries to take a look at these structures and see, what's going on. I wouldn't necessarily jump to an MRI or a CT, but for GYN purposes, the ultrasound is great. So doing that to make sure everything looks okay is a great option. But pelvic pain can be sources other than GYN. It could be your GI tract. It could be your pelvic floor. It can be radiating back pain that goes into the pelvic floor. So there's many different causes of this. It's a very complex workup. So there may be multiple imaging modalities required, but the first thing that I would start with, just to make sure you don't have an ovarian cyst or a fibroid or something going on in the GYN organs, is to do a ultrasound. Okay. Okay, we answered that question already, and I think I'm going to stop. Okay, Can we get pregnant after losing? Yeah, we answered that question. Okay, so we're gonna stop for today. This was so much fun. I would love to hear from you guys if you like this format of just kind of rapid fire question answers, or if you prefer to have a predetermined topic, which I've been doing so far. So in the past, I've usually had a topic that we advertise and then we talk about that topic and do Q&A. But I figured at least once a month we can do this kind of just random Q&A on any topic that's GYN related. I would love to hear your thoughts. Please let me know in the comments. If you found this useful, please share this with your friends, family, coworkers. Follow me on YouTube as well as Instagram, and you can sign up for our email list. If you go on my website and scroll down to the bottom, you can sign up on my email list where I will send you an email every month just with what's new in women's health, or what we're up to, what new things we're doing in our office. It's just a great way to keep on top of women's health and GYN health. So would love to have you guys there. And until next time, and don't forget to comment on, what format you prefer. Okay. Have a great day, everybody. Bye.